So now we continue with our pharmacology syllabus. I'm just trying to move through all the syllabus of pharmacology so that we'll now go back and start discussing chapter by chapter. So here we're now trying to look at a syllabus that has to do with antifungal drugs. So for the antifungal drug, we give a preamble, give the examples of drugs that fall under this category, their mechanism of action, and all of that. So antifungal drugs, of course, this is a picture of a fungal. Alright, they grow like trees, okay, but archaic trees, not really the true trees. So antifungal drugs, just so you know, they are drugs that are against the growth of these fungals. So if you have a fungal infection, you use these drugs to treat them. Okay, so fungal infection, another name for it is mycoses. So they can be categorized into several groups, which we'll get to look at the groups. Do you understand? Because the most important part of this lecture is trying to look at the groups and also the drugs that fall under this category. So I think I have some beautiful pictures of the drugs. Okay, few, not all. You understand? Because each of the drugs will still come and talk about their pharmacology. So first we have the polyenes. So examples of polyenes, we have drugs like the Amphotericin B and the Nystatin. This is Amphotericin B. Okay, so these drugs, how do they actually take their activities against fungals? So they bind to the ergosterol in fungal cell membranes, and they create holes in the membranes. So this will now lead to cell death. Okay, so Amphotericin B can be used in treating systemic fungal infections. That's basically fungal infections that are like affecting the body at large. Then Nystatin is mainly for candida infections that could affect the genitals, that could affect the mouth, and all of that. Then for the next category, we have drugs like the azoles. All of them end with the word zole: Fluconazole, Itraconazole, voriconazole, ketoconazole. Do you understand? So this is a picture of fluconazole right here before us. And these drugs, how do they work? They work by inhibiting the fungal cytochrome P450 enzyme. Of course, this will now block ergosterol synthesis. Ergosterol is like their outer formation. That's a component of their outer membranes. So if their outer membrane is not able to be formed properly, you have a weak fungal. Okay, so fluconazole is used in treating all those candidiasis, cryptococcal meningitis. Itraconazole is used in treating histoplasmosis, blastomycosis. Voriconazole is used in treating all those invasive aspergillosis and all of that. For the next category, we have the echinocandins. So you can see one of their example here is what is known as a caspofungin. Okay, so for the echinocandins, we have drugs like the caspofungins, we have the micafungins, we have the anidula fungin. So how do they work? They work by inhibiting the beta-1,3-D-glucan syntase. That's an enzyme, right? Now that enzyme is very important, okay, in the formation of a good fungal cell wall. Okay, so if you block the enzyme, of course, the fungus doesn't have a good cell wall, so it's now easily being attacked. So it's used in treating invasive candidiasis and aspergillosis. Then we have another category which is known as the allylamines. So allylamines, we have drugs like the terbinafine, we have the naftifines. Okay, so they inhibit an enzyme known as a squalene epoxidase. Squalene epoxidase is also very important in the formation of a good cell wall of the fungus. So if it is disrupted, of course the cell wall is weak. Okay, so it's mainly used in treating all those dermatophyte infections like the ringworm and the onychomycosis. Okay, so other agents like the crisofulvin, okay, flucytosine, cyclopyrox, and the rest of it. So this is to have about the beautiful introduction to antifungal drugs.